Hey, it's Anika.
And Ashley, and we're the Real Nurses of Miami.
And we're here live with Dr. Triggs.
Thank you for having me.
Thank you for having us. We are dripping and chatting with Dr. Triggs, so we have some questions to go over with him. We didn't give it to him ahead of time, so it's just fresh off the dome.
That's right.
So here we go.
No pad or pencil.
So today, Dr. Triggs is getting an immunoboost drip from us. It is packed with vitamins, electrolytes. He's still a little bit tired, but I'm pretty sure it looks like he's getting his energy back, his fuel back. So this is a really good drip just for boosting your energy, boosting your immune system, and especially for our body babes that are having plastic surgery. The B12 kind of helps you get that boost of energy so you can start walking and ambulating, as Dr. Triggs said. That is like the #1 tip after surgery. #1. So how do you feel? Do you feel any different yet?
Yeah, I feel like I got like a little surge of energy. I was playing golf and drinking all day yesterday, and so now I'm just trying to replenish those essential nutrients and getting hydrated, and I'm not cramping as much. I went hard in the gym all week, so yeah, this is perfect.
Good. I was a little nervous. I was like, you look a little tired.
I know how to
So
turn
this
it
could
on
be
and
you too. Be like Triggs. Get your drip.
That's right.
The first question is, do you analyze random pedestrians and think to yourself, yeah, she got a tummy tuck, or yeah, she got a BBL?
Not really. So it has to be something like super obvious or like grotesque or something. I'm like, man, what happened in them type situations? But like but the average person, I don't be like, oh, I can do this, I can do that. It has to be like something like way out of the ordinary that somebody else is already looking at. And then I'm like, oh, how could I fix this? And that's the only time it like really snaps on.
Really? Because sometimes when I see girls, I'm like, she's too perfect. Yeah, she did her butt, or she did
We'll be like,
this.
you think she got a BBL? Yeah,
So
those hips are way too perfect.
You never analyze like that?
Well, I know like in med school and in residency, like as you learn, you start seeing it a lot, so you do start analyzing.
Oh, okay.
But I mean, when I'm off the clock, I'm off the clock.
Okay.
I'm very like one-track minded.
Okay. All right. Awesome.
So we're gonna ask some questions like from the surgeon side and then from the nursing side.
Okay.
So what is your favorite procedure to do?
Oh man, that's a good one. I would say either breast augmentations or tummy tuck. I think it's more like the instant gratification, and then knowing it's gonna get better as like all the swelling and all that goes down. And a lot of times patients, they start picking up these exercise routines, so they enhance their results even more. Right. And so I'm always excited to see that like later down the road too. And then I think like, I think it gives them what they want at the same time. Because some people, they're kind of on the fence. They'll say they want something, but their expectations is for another procedure.
Right.
So
yeah, that happens a lot.
those are probably my favorite too.
Okay.
We have to say ours.
Oh, I feel like my favorite procedure to recover, maybe just BBL.
Yeah.
Just the BBL by itself.
1000%.
Yeah.
Lipo BBL. It's fun because then you get to look at them like, oh my God, you look amazing.
I would look like that.
Right. That's exactly what I do.
How do you feel about the recovery for BBL tummy tuck?
Oh, that's our next question. This is our next question, and we're gonna talk about that. So, what is your least favorite procedure to perform, and why?
That doesn't mean not to book it.
Yeah.
That's right. I would say the mommy makeovers. Like I like doing them. They're long, and you gotta like pay attention to so many different things, and you have to follow like a certain order of operations. Like I can't jump down and do the tummy tuck first. I should do the breast first because that's gonna affect like how things come out. So it's just a lot like cerebrally. Like it's a lot of parts to it, so like I'm always having to like stay focused. Right. Like when I'm doing a breast dog, it's just like boom, 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 boom. It's almost like muscle memory. But the mommy makeovers is like this,
Right.
Yeah.
I didn't know you had to do this first, then like in the process.
I always thought, but I was like, they probably do. I don't know what the heck they do first. I always thought about it.
So for us, our least favorite procedure to recover, that doesn't mean don't book us, because we will recover you well, is the combo. We don't really like the tummy tuck, mommy makeover, and BBL, just because when they're recovering, it's kind of hard to be like, okay, you definitely cannot lay on your stomach, you can't dehiss your wound or anything, but then you're not really supposed to put pressure on your bum. But even if you're offloading when sitting, eventually you're gonna, put pressure on your bum. So something might compromise a little bit of the BBL.
It's
So
just,
that's-
and then also it's just hard getting them, clients comfortable because then they're like, oh, why did I do this? And it's like, see, I told you to separate it. So it's just like, it's very difficult, but I know a lot of people, they want to factor in like, okay, I'm just trying to come to Miami one time, get it done in one shot. They'll be like, I have a wedding coming up. Like I need to be snatched by next year or in 6 months. And I'm like, oh God, okay, well, you could do it. It's just know that it's not going to be the easiest of recovery and it's going to take a lot longer to get comfortable.
Yeah, most of my second and third rounds are people that had like BBL tummy tuck or something like that. Because if you're doing both at the same time, it's hard to do one like completely well or recover well enough to where they don't mess up their results. Yeah.
So when you say that with like when it comes to multiple rounds, do you feel like it's better to do maybe the BBL first and then the tummy tuck? Like, do you have a preference in order?
So for me, like if the patients are like higher BMI or have a lot more fat, like I really want when they do the tummy tuck to be just loose skin as much as possible. So lipo BBL, that's what I tell them to do because I'm like, yo, we can use this fat.
Right.
The only thing you have to deal with is the loose skin for a little while. Like I tell patients 3 months in between. And then we come back and then we do the tummy tuck because then I feel like it gives a huge difference. They can see their like abdominal muscles. And all my best tummy tuck patients have been patients that have done BBLs or lipo before. And then they come out just like, and then sometimes like, if we need to put a little fat in the hips, I'll do it. But, it's not like a full-blown BBL type situation.
So what are the top 3 tips that you think is essential to recovery, like after surgery?
After surgery, walking. Like that's the first thing I say, my pre-op and post-op spill. Make sure you're up moving around. Number 2, staying hydrated, whether that's water, liquid IV, Powerade, Gatorade. And then 3, if they can, have some type of post-op nursing. Like when patients tell me that, like I get like, good, thank you so much. Because I think people come down here and they think their boyfriends or, someone that has no medical training can like take care of them and they don't know what to expect, especially if they're getting lipo and they see all that fluid starting to drain. They're gonna start freaking out. Those guys seen that before. So that's like, it's almost like a pet peeve of mine. I'm like, yo, just spend the extra money, get the post-op nurse, and you only really need them like maybe 24 hours. And I'm telling you, it's worth its weight. And so I really preach that. So those are my top 3.
Okay. Awesome. We agree. We concur.
We co-sign.
And the next question is, what is your views on patients getting a post-op IV infusion or pre or post-op IV iron?
I'm all about it. I'm okay with it. I actually tell patients, they'll be like, oh, what if I have an IV schedule? Is that okay? It's like, yeah, that's more than fine because that's what we're giving you here in the OR. Still make sure that your intake is good by mouth. And I have no problems with it. I think it's a good idea.
Awesome. And then the last question that we have, can you tell us how you guys get these girls in their fajas on the table?
It's a team effort with the anesthesiologist at the head, me and the surgical assistant, and then the OR nurse handling the feet. But yeah, it's not easy. That's why we get a lot of complaints like, oh, this faja's too loose. And I'm like, well, we just have to swap it out because if you try to put it on like directly, like super tight, you're not gonna get it on.
I commend you guys.
Right, I like try to just envision it because it's hard when we're like assisting with showers and helping them, and they can stand in front of us and hold a good bearing and pulling it up. It's hard. So I'm like, how do they do this on the table?
Or imagine them like fresh out and they're like really sore and they're like,
Because even then we're like, how the hell did you do this when you were sleeping? Like, and you're dead weight, like busting a sweat. I know you guys bust a sweat.
That's why it's so cold back there in the OR. Like,
oh my God.
It's warm.
So I think that ends our session. Come get dripped with us like Dr. Triggs is. Book your pre-op iron, book your post-op drip.
And book your full service nursing recovery. It is so important. We can't stress that enough because it's going to save Dr. Triggs a headache. It's going to save you and your family members a headache. So book your recovery care.
Okay, thanks. Yeah, thanks. Okay, bye.
They should have said, don't get scammed. That's the hard part.
Don't get
Dr. Triggs endorsed. Bam, put the stamp on.